New at noon, there are two new COVID variants that the Centers for Disease Control and Prevention is monitoring. Plus, the government is expected to release a new COVID booster shot next month. But what should we expect from the coronavirus this fall? And joining us live right now is Dr. Vernon Rayford with the Northeast Mississippi Coalition Against COVID-19. How are you doing this afternoon, Dr. Rayford?
Doing well.
Doing well. That is great to hear. So how concerning are the current new COVID variants?
I think there's reason to be concerned and aware because of the strains that are going around in the rest of the country are often the strains that will cause surges here. We're in the midst of a mid to late summer surge that our area has actually had midsummer to early fall surges. And so we're in the midst of a surge or an increase in COVID cases.
Okay. Now, when you look at the numbers from across the state, there are several websites that are saying that Mississippi is ranked 4th in the nation when it comes to COVID infections. How true are those numbers compared to when we were under the public health emergency?
Yeah, so I think it's worth recognizing that while we're under the public health emergency, every COVID positive was actually reported to the Department of Health. And so you had certainly more of the cases represented it. Now we're back to the surveillance systems that we use for flu and other respiratory, where you have voluntary participation by certain hospitals and clinics and things like that. And so you have to be conscious that our measuring system has changed. But those systems, those surveillance systems are important, and we are seeing more cases of COVID, and that's actually the numbers have been going up since late July and into August, and that's actually fit with the pattern that our community and the rest of the communities have seen with a mid to late summer surge.
Now, with the fall 2023 COVID vaccine boosters, will they actually work for the new COVID variants?
Yes, so we anticipate that that the new boosters will work for the variants because of similarities between the targeted strain for the boosters and the current variants that are causing the increasing share of the number of cases now. So we expect it to work for sure.
Okay, and then who and when should people get the new COVID vaccine booster?
So I recommend everybody who can get a COVID vaccine and they are not up to date with their boosters to get the newest boosters. When we anticipate end of September, October for the new, and I say new, I mean fall 2023 boosters. We expect those to be available end of September, early October. And I'll new boosters will be available then. And if someone has not had the current booster, so the bivalent booster, I recommend that if you've not had it, you go ahead and get that bivalent booster right now, and then be prepared to get the new booster. I imagine there's going to be a waiting period between boosters, but get it as soon as you can.
All right, then. Thank you so much, Dr. Rayford, for joining us this afternoon.
Thank you.